Welcome. This video is talking about how to do a CQI review. That's a continuous quality improvement review. This applies to people who are doing CQI. You're going to start off finding the report you're looking for. Commonly, you'll put in the shift if you're assigned a shift, or you may look for the member specifically, and then you're going to go to current review type, and you're going to look for ready for CQI. From there, you search, and you're going to find any reports that are marked as ready for CQI within the parameters of your search. You're going to open that up. CQI doesn't deal with any NFIRS, so you don't have to worry about that. You're going to go straight to Fire Incident EMS and open up the patient care report. So generally speaking, CQI is looking at the clinical appropriateness of the treatments, the differential, the disposition, the treatment plans, and the treatment pathways that the provider took, as opposed to looking for accuracy and correctness of the report itself, which is something that the officers review prior to this being pushed up to CQI. That said, if you do find things missing, you can kick it back down for corrections. So typically you're going to start out and you're going to take a look at the age. The age clinically is an important factor, changes some of the medicine that you're looking at. So here you look at the age. You're going to briefly look at the complaint reported. None of this really applies much. You're going to look at the response times to make sure that from the time that they arrived at the patient to the time they left the scene is appropriate and within the parameters of a normal call. 10 minutes for trauma, 20 for medical. And if not, it should be documented here and also in the narrative where the delay occurred and why. Then you're going to look a little bit at the symptom and the primary impression. That's generally just to get some background on what you're looking at. You might look at the chief complaint. And then you might, if there is something in the medical history tab, you're going to look at that. And then you really focus on the narrative. This is where most of your work is done. Things you're looking at, making sure that documentation is appropriate, that all the pieces are there, whether it's SOAP or S-chart or a different format, that it's complete and appropriate, that the statements follow best practices, that abbreviations are correct, that spelling and grammar are correct, and that this is a professional looking report. Generally, best practice is always going to be everything being in your narrative, including your history, including your treatments, even if they appear elsewhere in the report. There is no specific way that we're requiring people to write reports, so long as they're complete, the assessments are appropriate for the chief complaint and the patient presentation, that the treatments are appropriate for the patient presentation. So you're essentially looking for those two things, whether the treatment and the thought process from the provider was appropriate, and also whether it was within the confines of our protocols. So that is what you're looking for here. And of course, you're always looking to make sure that the report reads well and is professional. From there, you're going to take a quick look at the vitals, make sure that enough vitals were taken, that they were taken often enough at the correct intervals, that the right types of vitals were taken, for instance, blood glucose checks when required. And then you move on to interventions, which you can look at if you don't see them in the narrative. Make sure that the doses seem appropriate for the presentation. And then you're going to go right on down to documents. And documents, the main reason to look at documents is to look at an EKG and make sure that the interpretation of the EKG is correct, that there's nothing missed. And that is the primary function. You don't need to change anything. If you find something that needs alteration, you have a few options. You can go to review and CQI corrections needed. You can also do a follow-up, which we don't do often. If you're working on it and trying to figure out things and it's taken a little longer than you have, you can put it in progress. And then some things get kicked up to the EMS coordinator for further review. Or if you just need another set of eyes on this, you can do that as well. And that'll be typically a level 2 review if it's staying in progress, or kicking up to EMS coordinator. If you're going down, it goes back down to 0. Once it's all finished and you feel comfortable and it's set to go, you can set this for final approval, level 3. We're not going to do that right now because we're still using this this report for some of our videos. If you are going to do a CQI, you're going to open up the CQI system, log into it, and you're going to create a new audit. You'll put the call date, the incident number. Those will be found on the call. Right, we can see here incident number and the call date. Lead care provider, you go find them. Oh, that's probably better. Put the call type, chief complaint, and then the report reason. So you have a few options. Some things are mandatory if they did ACLS procedures, advanced airways, alerts of some kinds, field pronouncements. These are all mandatory audits. So you're going to do an audit on them. And that doesn't mean anything necessarily went wrong. It just means you're going to look at it a little closer. And then you also have the opportunity to do excellent care, which is nice. And then you might have a secondary reason. Maybe a provider requested it. Maybe they did physical restraint. If you think it's interesting, you can flag it for a case review and say, hey, this is a good case for learning about Haldol. And then your comments. Dear Lynn, you should work on typo. So, and then if you're looking at our protocols, it's always a few things that are good practice when you're giving your comments. You're wanting to give them constructive, actionable feedback on how they can improve their narratives, how they can improve their thought process and their clinical decision making. And then if there are protocol deviations that we need to look at, you might just refer to them. Then you're going to send it to the care provider. It'll go, they'll read it, they'll comment on it, say, yes, okay, I copy, or they'll argue, or something will happen. Then they'll send it back to you. If it's something that you need a little more guidance on, you can send it up, or you can, at that point, save it and mark it as complete. At that point, you're going to mark it as complete here. So that is the basic process for doing a CQI audit.